Arixtra. Introduction. Thinned blood clots faster than normal blood. Select true or false. Correct. Thinned blood clots more slowly. Arixtra is a blood thinner. If you miss a dose of Arixtra and remember it when it is time for the next dose, you should not take a double dose. Select true or false. Correct. Increasing the dosage of Arixtra can cause complications such as bleeding that is difficult to stop. Arixtra is injected directly into the blood. Select true or false. Correct. Arixtra is injected in the fat below the skin and not into the blood. That is why you will be asked to inject it in areas of your body with a layer of fat, such as the fatty tissue of your belly between your belly button and your hips. You should use a different side of the stomach each time you give yourself an Arixtra shot. Select true or false. Correct. For instance, if your last shot was on the right, give yourself a shot on the left side of the abdomen for the next shot. The used syringe should be disposed of in a biohazardous waste sharps container. Select true or false. Correct. Dispose of the used syringe in a biohazardous waste sharps container. Do not dispose of used syringes in the household waste. Minor bruises are a normal side effect and do not require that you call your healthcare provider. Select true or false. Correct. Minor bruises are normal and do not require your healthcare provider's attention. However, large areas of bruising or unusual bruising are not normal and you should call your healthcare provider if they happen. You should not take aspirin while on Arixtra. Select true or false. Correct. You should not take aspirin while on Arixtra without talking to your healthcare provider about it. Aspirin slows clotting just like Arixtra. Thank you for using Explain.